Hello, grade 10 students. Here we talk about the drugs. What are the drugs and what do they do inside the body? What is the mode of action of each of drugs? We have endogenous chemical. Endogenous chemical, they are substances that are found or produced naturally inside the body, like the hormone, neurotransmitter, and so on. While we have exogenous chemical, they are artificial substances that are provided from external sources into the body, like the drugs or medicine. We have agonistic or antagonistic. Agonistic, the drug has the same function or the same effect of an endogenous chemical or endogenous transmitter, or if they don't have the same function or they don't have the same effect, at least they enhance, they facilitate its function or effect. Antagonistic, you are drugs that have opposite function or effect, or if they don't have the opposite function, they block the function of these drugs or they inhibit the function of these drugs. Analgesic and analgesic. Analgesic, they can cause pain. Example, the P substance. Analgesic, they reduce or relieve pain, like the morphine, for example. Mode of action of amphetamines are dopamine synapses. In normal cases, dopamine release in a few amount, it causes a limit in pleasure and hyperactivity feeling, which end after a short time. Amphetamine, as well as most ecstasy substances or drugs, they facilitate or they activate the exocytosis of dopamine, which play a role in controlling body movement, increasing the activity, and prolonging the feeling of pleasure. So these endogenous substances, dopamine, amphetamine, they are exogenous, and both of them they have a function. This function is called agonistic. They facilitate their function. Mode of action of morphine on the pain circuit. Usually there are three neurons that interfere in the pain message. Modulatory neuron that secretes the enkephalin, endorphin as a neurotransmitter. The presynaptic neuron that secretes the pain substance as a neurotransmitter, and the postsynaptic neuron that possesses the receptor specific for the P substance, which is responsible for the pain. So mode of action of morphine, it in normal cases enkephalin is released and bind to specific receptors, which decreases the exocytosis of the P substance. This partially inhibits the pain message. Morphine and enkephalin, they have highly similar spatial configuration, meaning that they are highly similar in shape. So enkephalin on the receptors and totally blocks the exocytosis. So morphine binds to the receptors of enkephalin and blocks the exocytosis of P substance. This leads to the total inhibition of the pain feeling. These are agonistic. They have the same function. Mode of action of cocaine on dopamine synapses. In normal cases, dopamine is released for short time, which dopamine is reabsorbed in the presynaptic neuron, while cocaine blocks the recapture of dopamine, which prolongs its activity or its effects by its longer fixation on its receptors. This prolongs the pleasure feeling. So dopamine and cocaine blocks the recapture. So there is blocking of the recapture. Here we have dopamine is endogenous, while cocaine is exogenous, and here we have both of them, they have an agonistic function. So cocaine inhibits the reuptake of dopamine and such that increased heart rate and blood pressure. How do you explain the action of cocaine? The action of cocaine is bind to channels on the presynaptic membrane and prevent dopamine from recapture by the presynaptic neuron. Action of dopamine persists as long as binding to its receptors, and we have cocaine acts as agonistic to dopamine, thus cocaine acts on a presynaptic membrane. Normal dopaminergic synapse, arrival of action potential to presynaptic terminal, the calcium ions they penetrate the presynaptic node, and we have dopamine neurotransmitter are released, and dopamine binds to both synaptic receptors, and the pleasure will occur by recapture of dopamine through channels membrane of the presynaptic terminal. Action of cocaine. In presence of cocaine, what will happen? Arrival of action potential, CE2 plus, penetrate the presynaptic node, release of dopamine, binding of dopamine to the postsynaptic, and there is no recapture of dopamine by synaptic. Pressure effect or pressure feeding will persist longer. Mode of action of curare and acetylcholine synapses. In normal cases, acetylcholine is an excitatory neurotransmitter which lead to the contraction of the skeletal muscle. While curare and acetylcholine they have highly special has special configuration, they have highly similar shape. Thus curare bind to receptors of acetylcholine, preventing the binding of acetylcholine. This leads to the muscle relaxation or even it may cause the paralysis. Acetylcholine is endogenous, curare is exogenous, and both of them they are antagonistic. So nicotine functions fills and activates acetylcholine binding site, producing effects such as increased heart rate and increased blood pressure.